Knee pain is a common complaint, but the good news is that it can be managed. Dr. Erlichman from Mercy Health shares a few simple solutions that you can start now to minimize knee injuries.
Obviously, the best treatment is prevention, certainly, and there's a lot of things that go into it. For the younger athletes and folks that are kind of at higher risk for knee injuries in that standpoint, there's some really good athletic training programs available. If you're able to do what you need to do on a daily basis and get around and you're trying some Advil, that's fine. But if it swells up really big, if you hear a pop with an injury, if you're not able to walk, obviously, if you have some weakness where you're not able to bend or extend the leg, then something might need to be taken care of there. Injuring the ligaments is the most common one. The ligaments are little soft tissue connections that hold the knee together basically and keep the knee stable. So very problematic when they're torn. ACL is the common one that we hear about and focus on a lot. That's the one in the front of the knee. You've got 4 big ones on the inside, outside, and one in the back also in addition to that can be torn. And if those are completely torn and unstable, and that's where we have to talk about fixing them. But a lot of times they're just sprains or strains, and we can sort that out without surgery. So the quadricep muscle, the front muscle in the front of your thigh, goes across your knee joint and inserts down on your legs. So if you can make that strong, that makes your knee joint more stable. A lot of us have really tight hamstrings just from our day-to-day lifestyle, and you cannot stretch your hamstrings enough. I do it myself every day. It helps with back pain, knee pain, all the above, and it's very common to have tight. So that's a very important thing to work into your training programs and your warm-up programs. And other things outside of just stretching, like yoga and Pilates and those kind of things, can be really good for knee conditioning, stretching, strengthening. Soccer, basketball, volleyball, those are the common offenders for those non-contact injuries with a lot of pivoting. And that's where really, if you're playing those at a higher level, if you're not already working with your athletic trainer, a program like we have at Mercy with physical therapy, specifically designed for injury prevention, improving your neuromuscular control and your awareness about where your leg is when you're doing those activities, is paramount. Some of the other, just for your non-athletes, just trying to prevent injuries from, weekend activities, skiing, hiking, that kind of a thing. Just warming up, being really diligent about your stretching beforehand, I think is helpful. And I think there's definitely room for braces too, whether it's gonna, completely prevent your knee from having an injury, maybe not, but at least it gives your body some awareness of kind of keeping in mind where your knee is in space and being cognizant of how you're walking and all those kinds of things. The more you can keep it moving, keep healthy, keep a daily workout routine, a daily stretching routine, that's the best thing for it. Letting it go for, not doing a whole lot for 6 months and then jumping there out in the basketball court, that's when you're at really high risk for an injury. But if you can keep up the flexibility, a daily stretching routine, I kind of tell people to think of your muscles like a rubber band, because they do have elastic in them. And it's like a rubber band, if you don't stretch and it gets nice, all tight, and it'll break very easily, it'll snap. But if you can keep it nice and elastic and stretched out, you should be setting yourself up for success with sports and exercises and all things like that. What it comes down to in general is just trying to be realistic. Think about your lifestyle. Am I going to be able to make it to the gym for an hour a day for 5 days a week all of a sudden? Probably not. But what can I do, in my lifestyle that's going to be realistic, that I can realistically do in terms of adding in exercise to my daily life? We got to listen to our bodies. If something feels tight, if you feel like you have tight hamstrings and you go out there and try and play pickup baseball, you're probably going to pull your hamstring. If you just have pain that's getting worse instead of getting better, it might be time to get in the doctor's office and talk about it. But in general, I think it's just about listening to your body, avoid things that hurt and trying to stretch muscles that are tight and all those kinds of things.